For the first part of our lab, we're going to perform an abbreviated form of standing postural exam. Patients, you should be standing comfortably with your bare feet. You should be facing away from your doctors. Doctors, let's take a look at your patient's shoulder height. Take a look at the shoulders and see if the left is higher or right is higher. In this example, you can clearly see the left shoulder is higher versus the right. Next, we're going to assess the heights of the left and right inferior angle of the scapula. First, try to see if you can estimate where the inferior angle lives looking at your patient's surface anatomy. Once you have an idea, draw an imaginary line and see if you can compare if the left inferior angle is higher or the right. In my case, left is higher than the right. Patients, now turn to your side for the lateral view. Doctors, imagine a mid-gravity line and assess to see if your patient's humerus is anterior or posterior to the mid-gravity line. Patients, turn towards your doctors. Doctors, let's look at your patient's carrying angle. Draw an imaginary axis going through your patient's humerus and draw another imaginary axis going through your patient's forearm. The angle formed by the axis of the humerus and axis of the forearm is the carrying angle. If the angle is increased, we call this cubitus valgus, and if the angle is decreased, we call this cubitus varus.